All right. Let's see. Hope everyone is doing well. We're letting a few of the folks continue to join before we kick off, maybe in about a minute. All right. Good morning to everyone. This is Mark McKenzie. I'm with Exdion Health. And maybe as a refresher, I'm the Vice President of Business Development for Exdion. And Exdion Health is, for those who may not know, a global technology company that really kind of tailor fits or customizes AI solutions for clients around building return on investment and generating measurable savings around coding, clinical documentation improvement, and full end-to-end revenue cycle management. So out of that, with me is Stephen Presley. He's our Chief Strategy Officer with Patient Plus. And so, Stephen, why don't you give us a quick intro, maybe how long you've been in healthcare, where you went to school, some credentials, and any healthcare associations you participate in. Stephen?
Sure. Thank you, Mark, for the introduction. My name is Stephen Presley. I'm a licensed PA, physician assistant, physician associate, depending on which state you're in. I've been in healthcare now as a practicing PA for over 10 years, closer to 12. I started out in orthopedic spine surgery and interventional pain management before getting into urgent care and occupational medicine. About 10 years ago, with my supervising physician at the time, we started Patient Plus, which is our current organization. We opened up our first clinic right next to where an ER had just closed down. So we felt the community needed the services, and it was a good time to act on our model. So fast forward 10 years, we've opened now. This year we opened our 11th clinic, and this one was in New Orleans. And we are continuing to retrofit and expand the services provided out of our clinics, including occupational medicine, different services such as direct primary care and DME equipment being provided on site. Just continuing to navigate the waters, in the post-pandemic urgent care world. I also serve as president of the LAPA, Louisiana Academy of Physician Assistants, and the board of directors. I work with the legislative chairs at the Capitol, trying to advance practice scope and initiatives for the PAs in the state, and trying to expand access to care, which is a big issue in our state specifically, that we work with every year with the government.
Man, yeah, that's one long business card, that's for sure. No, I think that just kind of speaks to your experience and then dedication to the field. So, and I think you had just given a speech or something this week at the physician assistant conference, didn't you?
Yeah, actually, just drove back this morning. So we
this
we had
morning. Okay.
our state CME conference. So we had panel discussions and updates to the board and the members on just the latest with some of the initiatives being put out by the federal government and some of the funding. So we're trying to work closely with them to make sure that we're in a place to be able to provide that care and execute accordingly.
Yeah, I love that. And I mean, I don't know that we could have found a better person to really kind of represent one of our clients today in terms of this challenge to change a customer journey with Exdion Health. So, first off, really appreciate your time. I know it's valuable, and you seem like you never get a break with all that you've been doing. So let's just go ahead and dive in. I'll go over the agenda. As we discuss AI, the impact it's having on urgent care clinics today, Stephen, I really just want you to do a few things, maybe share your experience, some challenges, some successes, some potential failures, maybe. And for the listeners throughout the webinar, up in the top end of your screen should be a Q&A button. Feel free to continually ask questions in that Q&A section throughout the webinar, and then we'll answer what we have at the end. And sound good, Stephen? You ready?
Yes, sir.
All right. All right. So let's take a look at beginning challenges, right? So just to provide some context, Patient Plus operates in Louisiana, as Stephen said, 11 locations in the Baton Rouge and surrounding areas. And, as I'm sure most can appreciate, urgent care is absolutely getting squeezed on reimbursement. So either optimizing operations or adding ancillary services for enhanced patient care or minimizing acuity degradation, those are a must. So out of that, just want to talk through, and I've got 3 questions up here, and I'll let you certainly elaborate on those. But as you look at the, key maybe coding, billing, and KPIs for an operator, what are you looking at in terms of what are some key aspects of evaluating or as you're looking at a business as an operator, go kind of walk us through some of those challenges.
Well, I think one of the main challenges that we face is based on system usage. So a lot of it is dependent on the EHR or EMR being utilized, how it's being utilized in the practice, because urgent care is all about efficiency. It's all about throughput rates, and the biggest killer to any practice is that non-utilization or the downtime, right? Because the payroll costs, the expenses are set, your lights on, your staff's there. And if the patients aren't coming through the exam rooms, you're just constantly losing that revenue opportunity. So it's really important that you maximize the time that the patients are there and basically being as efficient as possible so that they do have a quick experience, and that the charting and the documentation that supports the billing is all complete. That way you maximize the billables for the time that they're there. And that's one of the things that, as an operator, and just applying my clinical experience and the work that I do with the PA programs in the state, it's no provider is trained on how to code really, or has a truly good grasp of how to E&M code, or how to make sure that you have the proper codes on the chart. So it's a lot of the systems, depending on which EMR you're working for, drop codes differently, or when when a certain procedure is ordered, it drops a code, or when different triggers drop different things. But you want to for a long time, I was always looking at, well, how can we become better? How can we check more efficiently, other than just random audits every couple of years? There was no real good process in place to look at lost opportunity for revenue based on mistakes, just based on E&Ms applied that were incorrect by the provider at the time of service. And traditionally, there's systems that will read or look and project or apply E&Ms based on what's there. And I've never encountered in my 10 years providers that always put everything in the chart that they could have. So it basically it degrades and decreases the amount that you can bill for, or lowers the E&M level just by default there.
Yeah.
So
and I mean, what you said, like with EMR, have you seen where if there is a coding capability in EMR that they are naturally maybe down coding or conservatively coding is maybe a better estimation, or what have you seen there?
100%. I think my experience just personally with the EMRs that I've used as a clinician, it would always project a code that was under what I felt like I would have placed if I would have done it manually, right? And it was consistently under. And I think they have to almost code or algorithm those softwares to do that, to avoid issues on the potential overcoding side. But again, it goes back to those guidelines change annually, and they change in the way that the codes are applied by payer, by coding metrics, whether it's time spent or based on produced billables, if it's labs or X-rays and medical decision making. So there's different schools of thought behind it, but again, none of which are most providers that I know have a good understanding of and how it works. So checking
Yeah.
the system just isn't going to happen.
Yeah. I think, just hearing that, are you based on documentation, if something isn't accurate with the coding, you're going to get a denial, right? And so you're trying to minimize that. You want a clean claim before it goes to the clearinghouse. And so denials would, I would think, increase rejections. And there's a myriad of reasons why it would get denied, from eligibility verification to anything, as it relates to coding. So certainly appreciate that. But I think the goal, to your earlier point, about EMR, is really optimizing that revenue for each visit, right? Maintaining that while you do have utilization, you want to maximize your revenue or optimize. So, and maintain guidelines. It was AMA and CMA guidelines to make sure that you're within that, and everything is a defendable position if you get audited.
Yes, sir. Yeah, traditionally, there's certainly many pivot points through the life of an urgent care visit, and starts up front with the registration and eligibility process. So the process for insurance eligibility, there's EMRs that have their internal products that do it, and there's other vendors and products that do it outside. And I've used every combination of anyone on the market. And there's still, in the urgent care industry, a gap of a patient walking in and providing one insurance and not providing you the other one that they have, or they have not coordinated their benefits. So really, at the time of service, you have no idea or no ability to vet that. I haven't found a product that can up front there. So it's just a constant evolution of best of breed technologies to try and determine, to prevent those things from happening. So you have, solid information to build the claims to, but also you have redundancies in place, and to be able to follow up on them for the AR side of things, but also during the visit to maximize those the billable codes and code them correctly with the modifiers and such that are basically individualized by payer.
Yeah, fair enough. And then you made a comment like you didn't really have a way to track what that looked like, in terms of having any, which kind of maybe is a good segue into the second question here, is how's reporting or business intelligence giving you these, actionable insights, been able to drive more informed business decisions? I mean, is that something that you guys are trying to peg to? Because you're a data guy from, all of our conversations. You're pretty buttoned up on all things data. So anything that you can crunch, has that been kind of a driver for you, is looking at that intelligence?
Yes, yeah, I think for a long time, years into the practice, I was just kind of OCD obsessed about pulling as much data as I could from our EMR and just processing it ourselves. A lot of what I did was manual manipulation outside of the system. So I would pull the content and then just sift through spreadsheets to try and create baselines or identify trends or ways that we could combat certain losses or certain, bad debt situations, and just kind of analyzing them. And the time it takes is it's extraordinary. Yeah. And as we scale the operation, and, I'm only one individual, and it's, so I have a very solid understanding of the reports and the build within EMRs, but, I'm always going to be limited by what I can do individually and the time I have. So that's where it was when we scaled at 11 clinic locations. It's almost impossible for one individual to try and process all that data efficiently, determine some kind of strategy, operation change, and then implement efficiently, because things are changing annually. So by the time you implement a change or a fix, payers change the rules and you have to adjust the following year. So it's just a constant evolution to try and keep up.
Yeah, no, and to your point, going to 11 locations you'd have to hire a team to do that, and still may not get it in time. So I think, if you think through, what data AI can capture and then throw that into a dashboard or some type of business intelligence tool, to give you that visibility, would certainly be important, and to make informed decisions down the road, right? Or look at trends, or, whatever the case may be, because as you guys are growing, what would that do to your head count? Would you have to add more bodies to fill that need, or could AI maybe fill those gaps where, now we're not having to go and increase our labor force because we found some AI capability in that effort?
Yeah, the data, you certainly by automation, by AI and by automation, it is a
Yeah.
direct correlation to lightening your payroll expense, because of whether it's at the front desk, the CSR position, and that, before implementation of certain things, we had to staff clinics with 2 front desk members just to make sure there was no bottleneck and that things got processed. And it's just the way the model is, that traditionally your front desk individuals are your lowest paid, least educated individuals from a degree standpoint, and they control
Yeah.
the financials of the business largely by doing their job accurately. So it's just to give them support of what automation can do, and checking things and cross-checking to place on one screen it's vital to the success of any organization, especially in urgent care.
For sure. And then, so what are some aspects in, just for our purposes, coding, I would say documentation, and all things revenue cycle management that you consider would be valuable just to improve overall process? And ideally, I think I put it in here, get it right the first time. The goal for us has really been, as a company, our 3 pillars, eliminate denials and rejections, get you that clean claim before going to the clearinghouse, optimizing revenue, and maintaining compliance. But so out of that, maybe share some aspects you have around that.
Well, sure. Before my partnership with Exdion, we did billing in-house, and we outsourced billing, all done within our EMR. But the thing is the analysis of the documentation, the progress note, and then the quality control over the code being placed. There was no real check and balance in place. It was just the provider drops the code, or the procedure orders that drop the code, and then it's billed. And it's up to the billing department or the systems to identify, is this set up correctly with the modifier, or if they notice a denial trend, then they educate us or notify us to, hey, we need to start doing this or that. But it was an inefficient process, because it would have to get to the point where you experience those denials and then go back and have to learn, train and learn individuals by how to change the way they're doing things. So it was very counterproductive from an efficiency standpoint. From a coding standpoint, or just the E&M coding, I spoke a little bit about that before, is it was always in our best interest to have a provider place a code based on how we could teach them to code on, if you do X, Y, and Z, that dictate the level X, level 4, level 3. But it's just such a constant education process, and with the coding guidelines changing, you have to constantly educate them and continue, and that's a very, very difficult thing when you have PRN staff and part-time staff that may work a few shifts a month and they don't attend the monthly meetings, and so you're constantly trying to catch up. And so it's the value in the automation, and what Exdion provides is that immediate, instant access to data and information that can be easily educated, but there can be actionable changes made quickly to avoid negative impact to the RCM process, and the delay in claims payments, and just overall collections AR from patient side and an insurance side.
Yeah, cash is king, man. That getting you paid, reimbursed quicker is certainly an eye opener for urgent care operators. Faster to cash. So maybe that's a good. Let's talk about the next slide here. Beginning with Exdion, these questions really, at the evolution of our conversations, Stephen, really, when they began, how were you as a urgent care group evaluating, an AI solution, and then we were really together collaboratively determining what the ROI would look like? Can you kind of talk us through that?
Sure. I think, I had been having discussions and meeting vendors across the country, trying to determine how to create a best of breed product. I knew, the EMR has their own applications and the way they do things. And I've yet to encounter one that does everything great. They all have fallacies and different things that are good and bad about them. So it's been my experience that best of breed technology is the way to go. So you find vendors that understand what they're doing and that can accommodate or customize based on your individual practice. And I think that, the unique challenges, so to speak, that we were facing, I was trying to evaluate vendors with AI that were really good at a specific process. So whether it was insurance eligibility and the front end process, from a registration perspective, just automating the data entry standpoint to get the patient checked in, to automation of the progress note and what the provider's doing from a clinical standpoint, both from a triage perspective, but then also a medical decision making standpoint of making, quick decisions, then charting them accurately and trying to make sure they're charting effectively and with basically the right documentation, because it's just constant that individuals rush and forget to do things. They'll order one thing and forget to document it, and so the note's left as is. So the code's on the chart, but there's no documentation supporting that it was done. So it's just a constant process. So I think it's trying to find groups that are able to be good at one thing. And it makes it a lot easier to kind of evaluate that AI ROI, so to speak.
Yeah.
Like if you're breaking it up into, and if you're applying something like a shotgun approach, then it makes it much harder, I think, to kind of really calculate ROI on one thing. So the way I did it personally was just broke it up into, okay, if you do this before I partner with you, I understood how to manually check the ROI based on my systems reporting that I could pull, and that kind of thing. So.
Yeah, I mean, urgent care, they have their own unique set of challenges, but I think some of the theming is around coding or denials or not maximizing or optimizing revenue. So those are consistent, but I think when you get in the weeds, there's some things that, I think we uncovered together that worked best for Patient Plus that may not work as well in another setting, but having that experience could just say, hey, I think we get you from A to B, which may be a little bit different variation than what Patient Plus did, but the benefit is that yes, we get you there because the challenges seem to be consistent. It's just how we get there is really kind of the special sauce in terms of what we create as a solution for the client.
Yeah, because it's the part, my colleagues and other practices that I've spoke with and consulted with are they're each individual practice will have their own set of circumstances based on the way they operate, the way they've trained their providers. So it's important that AI vendors and solutions are able to adjust and customize to that practice's need. Because one size doesn't fit all, and one AI application doesn't fit everything. So it's very important that the individuals from the practice side that are in charge with implementing and evaluating it have a really good understanding of where their weaknesses are and can kind of see before it happens the application of the AI, and then understand how to make sure that's the checks and balances are being hit once it starts. Because then that way you truly have a good idea of, is this working? How can it be improved? And it's just constant process improvement.
Yeah. Yeah. That continuous improvement. That's certainly important. So how do you think AI is changing the way RCM services are being delivered? I mean, I think you kind of answered that in the first question about determining the ROI, because those inherently are fixing some of the capabilities. So what are maybe some items within the revenue cycle management space that are being delivered that's changing with AI?
Well, certainly, from a personal experience standpoint in our relationship, it's the elevation of the billables, is where I can speak to the data and how we're living that realization. It's from a standpoint of depending on the practice, again, case by case, there's many RCM vendor relationships out there that bill based on, head count of individuals working for the practice and hours, and things like that are how many staff does it take to accurately or efficiently bill for that practice and the amount of volume they're doing. Well, AI, I mean, tremendously diminishes the amount of time it takes to do the same work. It does not get tired. It doesn't call in sick. It doesn't, so from a standpoint of when we used to in-house bill, it was just a constant management effort of individuals on vacation, taking off, quality of work, the headache of managing humans. And to a standpoint like utilizing AI, it can do all of that work for you. And there's just a tremendous, savings involved just from an hour spent application. Now there's still the human aspect of quality control. So you have to have an understanding of how it works and how to make sure you know how to check it just to make sure it's applicated correctly.
Right.
But outside of that, just straight hours reduction on doing the work is reduced.
Yeah. No, I think, that driving costs down, I think across the board, removing administrative burden where you can is beneficial in every urgent care because everyone has, just repetitive tasks that could be alleviated and let those folks focus on more maybe productive areas. And so, yeah, just that perspective, I think there's a certain benefit for AI in the RCM space. Now, how do you see AI playing a role in improving provider productivity, and I would even argue patient satisfaction? So maybe walk us through some of that.
Well, provider productivity is certainly, just speaking in terms of AI, looking at AI scribes and things that are
Yeah.
able to automate documentation successfully into the chart to expedite that process. It places less concern basically on the provider for having to remember to we discussed this, let me make sure I put it in the chart, or the different metrics involved, depending on how your EMR is set up. We're very template based and procedure order based, where these things can control the CPTs that are dropped, but you have to remember to order them or remember to drop them. So having systems in place like Exdion and the feedback that we get through the Promax portal, allowing the education to happen in real time and saying, hey, you mentioned this but didn't do this, or you mentioned this that you spoke with the provider but you didn't, this is missing from the chart. So it's that real time feedback that just you're unable to apply that level of detail efficiently in a scaled practice, sizable practice, without the use of AI. So from an AI standpoint in provider education, I think it's huge. And I think that from a patient satisfaction standpoint, it places less importance on the provider having to feel like they're overwhelmed or burn out on the documentation side of things, and they can spend more time in that exam room with the patient, just focusing on what the patient's saying, as opposed to having to worry about going back and charting everything and then making sure that chart's closed within 72 hours, or getting it locked on time. So it's like having an assistant for the providers, and they're busy, and the burnout is real. And so when you have busy days, it's a lot of stress or pressure to make sure that your charts are closed on time and billed correctly. So I think without receiving that education in school in a clinical setting, and you're just kind of expected to on the job implement and learn. This is like a coach, so to speak, that's kind of over your shoulder, watching your back and able to train you and teach you as you go.
Yeah, and I think, what the clinical documentation improvement side, I've heard a lot of buzz about that, in the last few conferences I've been to, especially on the clinical side when they're talking through how best to educate the provider. And I think one thing that really resonated with me in terms of CDI is now it's tactical, right? It's not this overarching, we're training on clinical documentation improvement. It's saying, hey, provider A, you're really good at documenting respiratory, but maybe in the ortho visit, you're not as good. So here's some clinical documentation improvement items that will help you to document a little bit better, or the right documentation. And then, provider B, they may be the opposite. They're really good at ortho, but they need some help in respiratory, for documentation. Now you've got this tactical education capability, with AI, and it's real, life examples of their cases.
Absolutely. I think the being able to provide the real-time feedback on individual cases and that they're seeing, it helps them connect the dots much easier than a general presentation being given once a month or biannually or something on,
Right.
hey, you need to improve this or that without actually showing them the detail of how to do it. So it's just that rapid download of data and the immediate connection of, okay, this is what I did on this case or progress note, and I'm being told by a coder, a biller, on how to
Yeah.
fix it and how to change it to be it correct. So, I mean, they're all smart individuals, right? Every one of the providers are they can learn, and so I think it's making sure that they adopt the culture of, I'm not a biller or coder, and I'm going to be told what to do and just learn from it.
Yeah.
So I think it's as long as they're willing to read and act on the information being given, it's a successful program.
Yeah, and I mean, I think that also kind of lends itself to better patient satisfaction or better patient outcomes, because by doing the right documentation, then you've got a better treatment plan potentially in place for that patient, and arguably some and hopefully better outcomes.
Absolutely.
All right, let's go to the next slide here. All right, so this growth with Exdion, and these are really in no order, but we'll just go one, two, three. What solutions have you considered or are you using that really bring efficiencies in that RCM, process? And what does that look like as Exdion and Patient Plus have really partnered together on this journey with you guys?
So I think one of the ways that we started our relationship and the ability for Exdion to customize to accommodate our current situation at the time was that in urgent care there's a dynamic of case rates versus fee for service
Yeah.
contracts with the payers. So I knew that almost immediately there was an application to improving E&M codes because of what I was seeing from the annual studies, or we would pick points in time and do random chart audits.
Yeah.
And traditionally it was a third, a third, a third, a third under, a third over, a third accurate, just on volume. But there wasn't a lot of actionable insight to be able to do anything about it other than continue to speak to them, present to them, train them on how to code. So I think at the time, the value though was relegated to those fee for service claims, because in case rate models, you're not going to get paid more for a four
Yeah.
versus three. They're just a flat rate reimbursement. So it was kind of a handcuffing in the ability to generate additional revenue. Well, the ability for you all to customize and focus on the just one specific set of claims, or certain specific claims as opposed to the whole set and price based off of that
Yeah.
is extremely important when you're talking about launching or piloting a new product, because you don't know up front, and it's an investment or a risk and additional expense that you're not used to incurring. So until you can realize the new revenue, the net new revenue, it's a risk. And that way, being able to do something like that really makes it palatable to launch and try new things in our industry, because every practice is trying to do that, essentially that same thing, trying to maximize their ability to bill for what they do and the services they provide. So it's just, Exdion starting at one level and then just realizing that revenue that we projected was going to happen, but wasn't guaranteed. But then once it starts to come in, it's like, hey, this works.
Yeah.
It's, and what we thought was going to happen did happen, and then you have additional monies to play with, so to speak, and reinvest in additional levels of coding, because that's going to bring additional net revenue and additional levels of feedback to the providers. So I think it's it'll be a constant evolution, a constant evaluation process to look through the data and realize where certain weak points are, but you can continually escalate relationships based on that, and just the managing, the AR and the denials and the typical ways that operators are able to do that. Seeing those numbers drop and reduce where they're supposed to really makes you feel good about the partnership.
Yeah, and I like because we went into an exploratory phase in terms of helping on the fee for service. I think we had identified something with one of your case rate payers too that we could also help with. Can you elaborate on, there was some, I would say, repetitiveness or maybe some duplicative efforts from one system to another that we could kind of launch one of our AI bots to do that for us? Is that something that I know we talked about, but I can't remember the payer. Anyway, it doesn't matter who the payer is, but were we able to solve that from the case rate perspective, or how's that looking?
So there's, it's the difficulty in the business is the individualization by payer. So
Yeah.
every the way you have to build this claim or process these claims is different from one to the next. So it's when things are identified as issues, or whether it's rejections, denials, or coding errors, so to speak. It's okay. Well, we have to get the actual rules of, like you're saying, this isn't a proper ICD code or diagnosis code to reimburse for this procedure code, but the other payers are paying for it. So tell me why we're not reimbursing, because I don't know how to do it differently. And so to date, I'm still waiting on answers from major payers in Louisiana on answers on what, if you're telling me I can't use this, then why are all the other payers reimbursing for it? So it's just that being able to then quickly have Exdion go in and generate reports of anything tied to that. It allows me to go transfer that data to the payer and say, hey, look, this is where we're sitting, and stripping it of whatever PHI needs to be done. But you're able to then quickly negotiate with these payers and show them the impact that this decision or this system error on their side is having on our practice. So it's very, very easy to bring ancillary value and just operations efficiency, in addition to just realize net new revenue in E&M elevation, which is an actuality we've been experiencing from the beginning. Just coding appropriately E&Ms, and the miscoding of new versus established in our business is difficult because we're manually applying those codes, and it's so you're always going to have a certain threshold of errors. So to fix those and appropriately build them, there's a significant revenue capture available.
Yeah, I would even venture to say down the road, because we have our end-to-end RCM can absolutely handle, if you will, the case rate piece and implement AI, knowing you're not going to get paid more, but layering in some efficiencies. And as I mentioned, that exploratory phase where, yes, we're constantly providing reports that could be helpful, and identified this one particular payer, to your point, that just wasn't paying. So I think thinking through that with an expert in the field is certainly helpful. So.
Mm-hmm.
So let's look at, on this slide, there's 4 bullets here in terms of, annualized revenue increase per claim, reduction in coding and related denials, and then reduction in claim rejection. So this kind of speaks to this question: how are you measuring the impact of AI solutions, especially with, our discussion today? Can you kind of elaborate a little bit more on those four bullets?
So most of my measuring is done based on that, what I had said previously about being able to extract financial reports and different data from the EHR, and then create the spreadsheets that I use to measure time of service collections accuracy, and measure revenue by allowables. and just making sure that, changing a 3 to a 4 for this pair, I understand exactly how many dollars that represents. So
Yeah.
then, when that coding is presented, or when the data is presented monthly to me from Exdion in spreadsheet format, how I want it and how I requested it, because
Yeah.
I customized the request of how I wanted to see the data to apply it to my own metrics and my own evaluations process. It was a very easy just plug and play to just match the data to make sure that, okay, I know exactly how much impact this is having on revenue versus the is having on time of service collections accuracy on in other initiatives for eligibility. And is it a training issue where the staff has the right information up front to make the decision and they're just not making it? Or is this a process issue where we have a process in place, but it's missing this specific scenario of they're not coding or they're not documenting the answer to this question, and it's causing a denial. And that way I'm able to just review that in the way that Exdion presents it, and in charting format and visuals to help meet with the providers and explain that to them quickly. So there's, in addition to just the metrics evaluation and measuring it, it's just having the data and the visuals to be able to show providers how they rank against their peers, and how basically to create incentive programs and RVU based programs that says, look, this isn't, we're going to reward you for being good at this and doing well at this and charting accurately and efficiently and practicing at the top of your license and being productive is beneficial to you in more ways than one, not just because it's the right thing to do, but because it also is the way to practice medicine most efficiently.
Yeah, and I think, you're getting a lot of buy-in, right, from at the clinical level, because it is making an impact. So, now they can see kind of where, to your point, where do they stack rank as a provider in the business. They're starting to adopt and understand that, what we're doing is crucially important, and how we're documenting crucially important. So get any of that education, and then have an incentive program around it is certainly, just kind of icing on the cake, in my opinion.
Right, and where I would spend, sometimes weeks or a month at trying to develop a spreadsheet to get to where the providers could understand it, or, manipulate it to where it's a simple ask to you guys to say, hey, I want to see the data in this mold or this model, present it like this, so I can then quickly take it and just, go to them and say, all right, here, this is what this means, and I'm going to give you this every single month to show you your progress. And then just ask questions. And, most providers are sponges and they want to keep learning or learn what they're not good at. And certainly billing and coding is something that's underlying that most people aren't, and just by nature. But it's and then it's incentivizing them to do so. It's making sure that you have the RVU plans in place and things that you can build based on this constant data, and you can evaluate the metrics on it to determine what you can spend to make them, invest in that quality.
Yeah, I think, so I'm another, for question number 3, what has been your experience? I'm sure it's been good, bad, ugly, as it relates to adopting AI in general, and even coding, and the CDI and RCM is really trying to weave our way through the process. Maybe talk through your experience of that adoption.
Sure. I think, it's anytime you're implementing something new, some folks like change, some don't. And there's always resistance, so to speak, or negative things out there that exist. And especially dealing with providers, which are creatures of habit, and, they like doing things their way. It's important that you don't force a specific workflow on them. You basically bring it to them as, hey, we have this new technology that can make you a better provider, that can increase your billable revenue, can make you better at what you do. And most people, when presented with an opportunity to become better, have some sense of pride and in their what they do and who they are. That it just regardless if they're working for us or somebody else, it's going to make them a better, individual caregiver, but also just professional in a sense. So it's
Yeah, I'd even argue making it a little bit more marketable too. So if they were to, let's say they moved and had to go to another urgent care group in another state or whatever the case may be, they've got that experience too that's going to serve them well because AI is here, right?
right.
It's not going anywhere. It's just, how can we use AI supplementally to help me? So.
Yeah, it's important that the operators and the controllers, the managers that are doing rollouts and bringing these things to them, just making sure that they have a very solid understanding of the process and can field those questions efficiently and vocally for others to hear it when asked, because things can be perceived negatively if you let them fester, as opposed to just putting them out very quickly to know this is the way this is done and this is why. And just having those kinds of those Q&As prepared prior to even receiving the question, it better suits you for success and implementation. I think understanding that it makes their jobs easier and it makes them better at what they do. I think everybody wants to adopt that.
Yeah.
So there's not a whole lot of resistance there. Now, laziness is something that's very hard to combat sometimes, and there's no realistic data or presentations that you can give to people if they're lazy. So the
Yeah.
work ethic is a real thing that everybody deals with in our business, or but it's you hope that the vast majority are the alternative, or the opposite.
Yeah, no, for sure. And I think, early on when we started, kind of our journey, we provided, you gave us access to your system. What we did is just a use case analysis of your existing data. Didn't cost you a thing. We weren't binding you to anything, but as we understand, let Exdion maybe identify some gaps and where we can help. I think really kind of springboarded the capability into, what the potential was in that use case analysis, because we were using your existing data and we were understanding, hey, there's some incremental opportunity here based on what we found. So let's talk through that and see what that would look like. How was that experience on the front end?
No, it was huge because somebody like me had obsessed over the data for years, trying to find opportunities for improvement and just review and review, and it was overwhelming and almost to the point where I was burning myself out. So to the point to where when you're able to, at no risk to me, go in and look at my data, who I feel like I understand better than anybody in the country. Our
Yeah.
practice data that I built from the first clinic to 11 and built the EMR and understand the ways that it works. When you're able to just go in and evaluate it for process improvement opportunity and show it to me, I'm
Yeah.
like, it's mind blowing. It's to where I it's like an assistant for me, so it's like I'm not just constantly looking and trying to find. It's the AI application to that and seeing where that these opportunities exist, and then it makes it much easier to do business and to continue to grow relationships when you provide no risk initial partnerships and evaluations to where there's every practice in the country is looking for ways to improve, and the volume reductions that we've experienced post-COVID, especially, everybody has to maximize that value of the volume that they do have, and this is the best way to do that.
Yeah, no, and I think what we also had done is, you've got ancillary sides to the business, whether it's lab or whether it's DME. This one particular instance, a shameless plug here for TLC and Sean Blackmore's company, but working with a DME company, I think that conversation that we had had with him, you were a client and there was opportunity for us to provide reporting on DME alone, so we can carve out that data, analyze to say, hey, here were X number of claims that could have been prescribed with DME and wasn't, and where it was appropriate. So now we've created a mechanism where you can look at utilization by provider to say, hey, here's what we billed in DME, here's what we could have billed but we didn't in DME, and then here are the things that we missed, and then what that looks like in terms of adding any incremental benefit to the practices or the clinics.
Yeah, and Sean and TLC are an example like Exdion of just being able to present their product and what they do in a fashion in which makes sense to any individual practice. They customize, they evaluate the practice, and they look at what it can be with the implementation of DME products, and then we had for years used a stock and bill model, so we never made any money off of the DME that we gave, and so
Shame.
it was, yeah, and it's just for 7 years, and just it's a shame. I'm just sorry I didn't meet them sooner than I did, but it's but then how do you grow that? You implement it, you teach providers and remind them to utilize it, and it's in any urgent care business, it's important to just constantly look for ways to be better and provide more quality care, and yes, ancillary, be able to bill for more because you are applying more care and CPT codes. So it's it's one thing to implement a product like that and know that the margins are there and it works, but how do you grow it? How do you have the providers adopt it and own it? And it's implementing those utilization programs and those fitting fee programs that are Sean's ideas, and just being able to use the reporting that Exdion provides in a business like mine that shows me the losses with the case rates and the being able to quantify to make sure that the billable reimbursement through fee for service outweighs the losses every single month and then some. So it makes it an easy business model that at a quote no risk type thing. So
and better patient care, right? I mean,
yeah,
if you're able to prescribe it, then it makes the patient feel better. Then that's going to better your patient sat, maybe your net promoter scores, however that looks. So, did they have a good experience?
Yeah, and providing them a sheet monthly in their meeting that shows them, hey, you saw 10 patients that fit the mold ICD wise of being able to provide this, but you only applied 2 DMEs. Your colleague here did 10 out of 10. Just giving them that data showing where the utilization is occurring based on ICD, and yeah, it's quality of care. It's I think most of the time with providers, it's out of sight, out of mind. So it's not necessarily that the patient didn't need it. It's just that they forgot we had it, or they forgot, they didn't think through that they could benefit from it. So, and most of the musculoskeletal injuries can benefit from the support agents and just being immobilized for a certain period of time. So it's certainly so there's. That project has been nothing but success along with the Exdion project. And I think being able to constantly evaluate the progress based on the data from Exdion is huge. So that you working cross vendor relationships like that is big.
No, it's been exciting, man. I'll maybe just kind of leads into our key takeaways here. Some of the things I would hope that the listeners would focus on is understanding those customer challenges. We know that they're unique within urgent care, but is something that we can provide that is real and it is measurable. If you look at outcomes included, these improved efficiencies, return on investment, right? Limiting your barrier to entry by providing some data to you at no cost or no obligation, I think is to what Stephen said was helpful. And then maintaining compliance, and then looking at that provider performance. How can we, educate the provider with clinical documentation improvement, which we know is important, but then arguably they're providing better patient care and providing the right documentation. I think Exdion Health's AI-powered solution, it does directly address the gaps that we did speak about. It's got, a multitude of benefit on things that we didn't talk about as it relates to all things RCM, from eligibility verification, even heavy case rate urgent care clinics, having revenue cycle and leveraging AI in place is certainly beneficial. And then I would say this ongoing partnership. I mean, Stephen was certainly kind enough to share an hour with us, 55 minutes. We'll leave the last 5 minutes open for questions, but just understanding the capability with Exdion, and then once we're helping and they see the value, what else can we explore there together to say, hey, here's where we think we can also benefit, and then just kind of following that same playbook is let us look at the data, let's evaluate it, let's present it. If it works, let's pilot it, before we do anything. And then if there is benefit, then we move forward. And if not, then hey, we tried but there was really no risk to the urgent care group. So, man, Stephen, I appreciate that. This was super insightful, and I've got this last slide. If anybody wants to, click on my bark, this QR code. It's just got my contact information. I'll send out some follow-ups as it relates to this webinar. And if you want the recording, happy to share that as well. But, as we look at, let me just go to the screen here and see if we've got any questions or Q&A. And I think, Stephen, you were so riveting. They were just really involved and didn't have any questions. So I think that may breed some questions afterwards to let them maybe think through what have they seen in their urgent care. And I would even argue, there are revenue cycle companies out there today that aren't really maximizing AI. And out of that, we have a white label product that, talking to other RCM companies, that maybe these listeners know today, that there's a path forward to be able to implement RAI with that RCM provider and then white label that to where they're starting to see some of those efficiencies as well. And so, yeah, with that, any closing comments, Stephen?
No, I mean, I appreciate the opportunity to speak on behalf of you guys. I think it's, again, the ability that Exdion has to customize their product and their value in different areas is key to the ever-changing urgent care world, post COVID and the things that we deal with on the insurance reimbursement side. So I'm very happy that I met you guys and do business with you. So I'm glad to speak highly of you.
You're making me blush, man. Come on. All right. Well, hey, I appreciate everyone's time. Thank you again. And you'll see a follow-up from me post this webinar. Thanks again, Stephen.
Thank you.
Bye, everyone.